Well, if this is your first time joining us, we are really informal. I want to just let you know, those of you who don't know, Joseph Harrison, if you'll wave, Joseph is part of the team at Advancing Employment here, funded by the Georgia Council on Developmental Disabilities, and Dr. Rackensberger, give us a wave there. And Amy Price, who is also part of the Advancing Employment team that some of you may know. Joseph is going to be putting some items repeatedly in the chat. The link to the Abolished 14C website, as well as a hot off the presses book guide for discussion. There are several folks that Nancy and I used to work with here in Georgia on the call, and we used to, hey, Gene Cannon. And we used to do book clubs, and we found that a very inexpensive, invigorating way to help us all kind of keep at the forefront the civil rights of folks that we care about and love dearly. So that guide you can use any way you like. Okay, and hello, Christine Fleming from Alabama. Joseph has just put that in the chat. In the past, and we have had some great webinars, but this spring series, Dr. Rackensberger kicked it off, and Amy Price curated two just excellent webinars that Joseph can link you to in the archive. Sorry, Christine, we're glad you're in Georgia. I thought you're back over the Alabama line, so glad to have you. So Joseph can put the archive webinars in there. We have, for some reason, and I'm not sure why, but we have lots of folks who contact us who've watched these webinars in archive. And so that's a thrill too. Just one other point, not just our Advancing Employment webinars, but if you're trying to, grow staff, give people some new skills and abilities, and do that in a formalized way, but yet ain't got much of a budget, picking and choosing some state webinars, national webinars, and having staff view those and have a discussion is an excellent way and an inexpensive way to grow those skills and keep our work at the forefront. Thank you, Jean. That's so sweet. Please put stuff in chat. One of us will be monitoring it. I'm in a little bit of a unique situation in that I'm welcoming you, and I'm also supposed to be trying to give you some information. But for those of you who don't know, we have a little motto, and we try to stick to it. You can use it all you want, but we really try to focus on not just content, but connection. Not just content, but connection. Not just slides, but social capital. And not just information, but inspiration. And we hope that we continue to do that today. Dr. Rackensberger also wrote for a grant from GCDD and secured that grant all around subminimum wages here in Georgia, building a coalition. Joseph will put those webinars in chat for you to be aware of and get on your calendars. But next week, we finalize this spring series. And for those of you who do anything with job development, I really hope that you join us next week. We've asked Mo Bunnell, who has been our private public partnership lead for probably a decade, who's also runs a very innovative business here in Georgia, but works all over the world, to join us, to give us tips about how to engage business and employers. Often it's people like us giving us tips, and that's good. Many of us have experience connecting with employers, but Mo is going to give us some great innovative tools to do that in a way that kind of reflects best practice in business. So you don't want to miss that one. It's next week at this time, so please join us. And Joseph is just saying he'll send all these materials out. All right, I want to introduce a couple people. The folks from Georgia, and I see a lot of Griffin Hamas, will know Nancy Brooks Lane. Nancy is going to co-facilitate today, along with a wonderful partner in Virginia, Richard Kreiner. Richard is he works at Virginia VR, but that seems too reductive because the guy reads everything and researches everything and is just an excellent resource. And we've had a great time getting to know Richard, who's really focusing on a project in Virginia through VR. And hopefully we'll have a little time to talk about that. He and Nancy did a VCU webinar that you can also see. If you don't have a VCU bookmark, you should do that as well. So I want to welcome Richard and Nancy. Well, today's topic is this book, and Richard and Nancy are going to ask me some questions. I'm going to do my best. I know a little about the questions, but I think they both have tweaked those questions, and you're all welcome to ask as well. I just want to say one other thing before we get started here, and that is I appreciate all of you joining. The community of practice is only as good as the people in it, and it is about connection. It is about inspiration. It is about hard work. Changing these systems is really, really difficult, and trying to do that in a way that honors lived experience and the trauma that some people have experienced from our systems. That's a tough one to admit, that for many people, many job seekers with intellectual and developmental disabilities specifically have had some trauma from trying to use our systems, trying to contribute in their communities and share their talents. It's a starting point. The other thing I think I would be remiss if I didn't say this is that there's a huge focus on trying to be much more person-centered in our work. And like so many other things in our field, we water down really powerful, meaningful concepts and tools. And to be person-centered means you must know someone outside of their label. You must know someone outside of the buildings that people come to. We have an enormous bias in our field, and that's a bias for buildings and programs. And it's one of the inherent parts in researching this book that truly outsiders can see. We may not see that as readily. And I'll finish up here and turn it over to Nancy and Richard. But this book is published by Cornell University Press, the International Labor Relations imprint. That means it's not disability specific. It's not VR specific. And so that writing it had to be in language that, again, people not inside of our systems would be able to understand. And that was no small feat. And that gave me some clarity as I was trying to communicate the sometimes bizarre things that we do in our system. So my hope today is certainly to connect with you all, and thank you all for being here, but is to get us to question a little some of the things that we take for granted and don't question. So, all right, I may regret this, but I'm going to do it. I'm going to turn it over to Nancy and Richard, and if I can't answer a question, I'm going to say, what do you say? Pass? Is that what it is? Pass? We'll come back to it.
Doug, I don't think anyone on this Zoom who knows you well would ever say you were at a loss for words. So, so I doubt that you will have any trouble. Richard, the first question I have kind of kicks it off from the book standpoint. Are you okay if I go first?
Absolutely.
All right, then why don't we just shift it back and forth? I do want to say, there's one thing that's sad. All of a sudden I'm sitting here and I I do have lived experience. I have horrible anxiety that I've learned to overcome and or not overcome, live with successfully, where it's just kind of a part of who I am. And then at times depression. So as I'm sitting here, I'm thinking, damn it, why is this coming out now? And I realized it's because there are so many of you who I see. And think about our lives, how we move through those currents of whatever the path we're taking lead us. Lawan, you were so critical in the early work when Doug wrote the first customized employment grant for Georgia. I know, Carrie, you will remember her. And the
Wait,
fun
hold
and the
on.
heart.
Can't wait. Terry's on here.
I thought I saw
Joseph,
Carrie.
Carries on.
Joseph, if there's a way you can kick him off the Zoom, that'd be fantastic.
I wouldn't have said that, Doug. You know, Carrie can outdo us both when it comes back to the classic comeback. So anyway, it is that we ebb and flow in our connections, and think about the folks who we love and care about, who are a part of our lives simply because there's still injustice practice. And so to help them have the opportunities that should be those rights that anyone has, we were able to enter their path. So imagine all the people in their lives who they connected with so intensely, who have come and gone. So I think it's just important to recognize that for ourselves, but also for the folks who we get to work with who happen to have a disability. So Doug, this is about you. So I'm taking my camera off and making sure that I have good bandwidth. So I guess one thing that kind of haunted me as I knew you were going to write this book, and I was excited because I knew you would say things that needed to be said that nobody else had oh gosh, what is another word for what I was about
Gusto.
to say? The gusto.
Courage.
Yes.
Courage.
Yes, courage to say. And so the topics that you cover in 22 cents an hour, they're not easy topics to understand, much less bring clarity to and understanding, where so many times it just does not exist. I can't tell you how many times I've thought, oh, that would be a great Saturday Night Live skit, when Saturday Night Live was at its most I guess the most irreverent. And so from disability history to social injustice to federal and state policy, just to humanism, being a part of the human race, being citizens. What was your motivation in writing the book, and how did you even begin to share that vision? I know that Cornell University Press has done some really wonderful things around work and unions and injustice, but still, people who understand discrimination in so many facets of life still don't recognize that discrimination against someone with a disability is no different. It just kind of blows me away. So how did you share that vision with the publisher, the editor? And I know that there were so many legal experts involved, because you do get into some critical information that some people aren't going to be happy to know you wrote of, and you're just documenting. You're just a witness to history. So how did you undertake that?
Well, I've shared this a couple times, and I think most people on the Zoom would agree with this too. I think most of us believed that after Henry's turkey service and those atrocities were totally revealed, in 2009 to the general public, and then the subsequent goodwill boycotts, which really brought, a small piece by Harry Smith on a program on NBC that used to be called Rock Center. I think most of us believe that, well, this is it. It's finally going to be overturned. And I don't even think that we thought it would be phased out. I think we all believed that after NDRN and Kurt Decker, disseminated the segregated and exploited, that on the heels of that atrocity and just awfulness, which, by the way, as we all know, and the book goes into this, is not an isolated situation. And I'll get to a little bit of the oversight. But when the Workforce Innovation Opportunity Act was finalized, and some of the folks on this Zoom were involved in informing that, the fact that it was not overturned in light of those atrocities, in light of all of the Freedom of Information requests that showed the harmful practice and the decades of abuse, I didn't know the answer to why it didn't get overturned. It was confounding to me. At that same time, I was close to celebrating 30 years in the field. And it was, to be quite honest, depressing to think you'd spend your life doing something and not have the answer to why. So, regardless of what type of book it is, you're trying to answer something. There's a great quote about, if a book is well written, they're all mysteries. And I think that is true. So I set out, Nancy, to try to figure out what forces were at play that kept this legal in the light of men being chased down when they left Henry's Turkey Service, of people being paid to make and stuff envelopes and all of that for gift cards. Some of those gift cards $1 and $2 each, or 10, 15, 30, 40 hours work. Why there were people, not just Goodwill, but CEOs and CFOs across the country through the Freedom of Information request that were making $170,000, $200,000, $500,000, while people were making as low as 22 cents. I found that it rocked my soul that I couldn't answer that after 30 years. And so that's the reason I set out, really to teach myself and to be a better advocate. I think not knowing our history, not knowing why we do some of the strange things that we do, only helps build up the disability industrial complex.
Well said, Doug. So I want to ask you a follow-up question, and being somebody that works in state vocational rehab, and what I think is a very critical, important time as it relates to supporting individuals with disabilities to achieve meaningful employment outcomes, competitive integrated work, quality of life, and all those things. Your book is kind of like, you strike me as being like the Upton Sinclair of the world of disability and employment. And it was very shocking for me to learn about some of the things that you uncovered in your book. But I think what's most important is kind of, what can we learn from it? What lessons can we take away? And so I'm wondering, at a time where we have this RSA innovation funding available that very much crosswalks to the topics you cover in this book, are there things that we can take from your book, things that we can use to inform how we approach state VR agencies, how we approach moving forward in terms of the RFA for that RSA OSERS funding?
Well, thank you, Richard. I just want to say again, because some folks joined a little later and didn't get to hear me introduce Richard. Richard is a phenomenal professional dad, advocate, and Stephanie from Virginia DD Agency made it clear in chat that my introduction was way too modest, and you're right, Stephanie. He's a great professional, great human being. Yeah, Richard, I think there are some things that are at least what we call in creative writing through threads, meaning that you can see some of the antecedents after the 1938 passage of the Fair Labor Standards Act that authorized 14C and never meant to authorize it for the way it is implemented over the decades. Most of those, just real quick, most of those were supposed to be what they call BELs, focused on certificates for real businesses. But today, and over the last 25 years, 98% of those 14C certificates are human service agencies. But knowing that history, Richard, I think it does inform it. So when you look at that request for proposals, and if you all haven't seen that, I should have mentioned to Joseph to put that in chat, but it's RSA OSERS. So if anybody wants to put it in chat, please do that if you have the link. Disability Innovation Fund, where they're going to choose 18 states, applications due June 21st. And many of you on the Zoom, have already been working on it and writing and all that. But the connection, I think, Richard, and it's a good question, is, and I hope it doesn't sound trite, so push back here if it does, but I think knowing the history keeps us, here's the cliche, from repeating it. But we do that a whole lot. One of the things in that RFP that I think is maybe not completely the first, but at least the emphasis is, and that is this focus on doing things that we know actually have evidence behind them. We've done a lot of strange things in disability and employment, particularly related to folks with intellectual and developmental disability labels that have no science, that have very little proof behind that they work. The whole notion of somebody earning subminimum wages for decades and being segregated, that was supposed to lead to a real job. That doesn't happen. That's not the only strange thing we do. We do lots of readiness stuff. We do lots of pretend work, all geared at, so settle in here, all geared at billing off of someone's mind and body. And that's the thing that is so disturbing, that the disability industrial complex is like so many other industrial complexes, whether that's pharmaceutical or military. The analogies are so broad and deep. The lack of oversight, not clear outcomes. What do we want for the money, the billions of dollars of money that are spent? So I think, Richard, the crosswalk is that we know in the past we've done things that don't have evidence, don't have science, don't have proof, and that we now have a set of tools that as we write for these, this is not just a grant. This is to liberate people from ever having to be treated that way again. My one qualm with both the 167 million from OSERS and then whatever ends up being appropriated with HR 2373 in Congress, some say 2 billion, is that there's not a dime of that money that goes directly to workers with disabilities for whom we have put in subminimum wages. And that's one of my goals with the book, is to make sure that, yes, we need to change business models. We need to change the low expectations. We need to support people, see them at their best, get rid of the stuff that we know doesn't have any science behind it, but also people should benefit from that funding, not just states and not just provider agencies.
Well said. Well said. And I'd love to hear from you. And I'll let Nancy go, but at some point, don't let me forget, I would love to hear a little bit about your thoughts on best practices and evidence-based practices, and how those types of approaches can be part of the solution moving forward.
Thank you, Richard. And I'd be remiss again if I didn't thank Debbie Gilmer. For what it's worth, Maine APSE has gifted a copy of the book to each rehab counseling faculty member in Maine. Thank you, Debbie. That's very sweet. Thank you.
So as I'm, wait. Oh,
We
no.
can hear you.
I thought I had muted me. So as I'm listening to Richard, who I absolutely adore and love to work with, just one of the most brilliant people I know who gets all of this. I have questions, but I'm going to skip an order, Doug, because this makes me wonder about one of the questions I was going to ask at the end, actually. So let me pull that up because it's not where I have my other questions. It's just something I came up with. So Marcel Proust, for any of you who love the classics, he was a French writer, just so creative, so interesting. And he has this questionnaire. It's this 35 questionnaire called the Proust questionnaire. It's often used like, I think Lipson, if y'all remembered on Bravo, he would interview, and he really did ask some good questions, which is not often the case. But one of Proust's questions, Doug, that I think would be a good time to ask now is, what is your greatest fear right now? You've written this book, you've done this work, you have family who you love and care about, who happen to have disabilities. What is your greatest fear?
That is a good one. I suppose, thank you, Nancy. I suppose if we truly overturn and phase out after, right now it's almost 85 years. If you look at the HR 2373, that would put it into, 2030. That whatever we do in policy, sadly, is probably going to last a century or nearly a century. And I think in disability policy, we're so flippant about not including people. And I think lived experience, I think people truly sharing the trauma they've had from these systems don't work. They don't deliver on what we say they're supposed to deliver on. They don't benefit the person. So who they benefit, of course, are the folks who are highly paid, for those folks to never get to an outcome. It's very, very lucrative to say we're working on it, to say someone is in supported employment, someone is receiving customized employment. It's much more difficult to say we are using evidence-based practices to get to that outcome. So my fear is that we'll phase it out. And the number that has really shocked me and hurt my soul so much in the research, and some of you already know this, but over the last 15 years, the organizations that have held 14C certificates and have phased those out on their own have increased their day habilitation enrollment by more than 20%. And there are a couple reports that say this is very scary because we don't even know what that's supposed to deliver. So my fear is that we'll phase it out, and all of us who love employment first and have siblings and loved ones and care about these systems will go, well, we did it, and nothing will change in terms of inclusion and having real income and getting to contribute in your local community. It's a fear, I'm glad you asked the question, Nancy, that we can do quite a bit about. Now, if you work for a state agency, I'm not suggesting you start contacting in your formal professional role, but as citizens, we can impact that bill that's in Congress to say these things, that if we phase it out, let's make sure that there's a disincentive in just simply moving people. Some of you also know that in 1986, there was a very weird structural change, and it coincides with the rise of lobbyists and trade groups. And that was In 1986, Congress was convinced that by the lobbying and the trade groups, that they would establish something outside of what had been known inanely as the minimum subminimum wage. Let that set in if you're checking text or email. We have a policy inside the disability industrial complex that dates back to 1986 that said there's a minimum subminimum. And that was to make us feel okay. It wasn't in statute, it wasn't in law, but there was this agreement that it wouldn't be less than half of the current subminimum wage. But through lobbyists and trade groups and people who had the ear of elected officials, they said, we don't need that. And that's how it became possible after 1986 to pay people as low as 22 cents an hour. I heard from a dad who's unfortunately, his daughter passed away before she could work and contribute, but she was getting paychecks that were half a cent. So that's the fear, Nancy, that we will set back and say it's banned, therefore everything's okay.
So Doug, this is Richard again. With that being said, it would really seem like we're at a very critical point in time that the opportunity to demonstrate that there are other options, that we can create positive outcomes and meaningful outcomes for individuals with disabilities is so critical. What role would you say, so as we think about that, what role would you say best practices and evidence-based practices might play in all this? For example, I know in Virginia, one of the things that we've been working hard to develop and create capacity for is customized employment. And to me, in so many ways, customized employment is representative of that innovative evidence-based approach, one that is very much person-centered and demonstrates, right, we have value in all individuals being a part of the workforce and all individuals having a similar experience in the workforce, regardless of abilities, right? So I think that's probably really important as we think about this opportunity to invest in new opportunities, invest in new services that are reflective of the values of today versus those older, antiquated ideas and values that we know are not at all healthy and where reflective of those of us who care and want to make an impact should be. You know, what can we do? What are your recommendations in terms of getting a handle on best practices and evidence-based practices as part of that solution?
That's a great question, Richard. I hope I can do it justice, even though I know I'll have to amend it a little. And so many people on this Zoom could, I'm sure, answer it better, or at least add to my ideas. But, you know, I think it's important to recognize that Joseph has put up there the discussion guide in the abolish14c.com, not to promote this, so please don't go to it, but there is a preserve 14c.org, I believe. So we're not even on the same page. After 85 years, the entities and the people working in this field can't agree that paying someone 22 cents an hour is not good practice. That's astounding to me. But I think that baseline, Richard, is important because the reason that exists, the reason we can't agree is because people don't understand. I talk to CEOs all the time, boards of directors, state agency folks, and they don't understand that their job is not to take care. Their job is not to have a place for someone to go. It is to rehabilitate or habilitate. It doesn't say in any of the statute with HCSBC and Medicaid waivers and folk rehab that you can just dream up any idea you want. But the oversight has been so poor that my hopeful part, Richard, is exactly what you've said. I'm glad that the RFP from OSERS includes evidence-based practices. I hope that that is mirrored in the HR 2373. But we have to do a better job of working with individual organizations, their leadership, to understand that their charge is not daycare. Their charge is not having some place for someone to go. It is to habilitate or rehabilitate. And to do that requires really excellent skills. And the people doing that work should be paid very well. And that they understand that part of their charge for using public dollars is to use practices, intervention supports that actually get people to work, actually deliver on the outcome, not 14 years later. One of the people I interviewed for the book had been in pre-vocational services for 14 years and there still wasn't a vocational outcome. How can it be pre when it's 15 years long? So Richard, I think one of the things I hope to be able to do, and we've had, I don't want to give Carrie Griffin any compliments, but Carrie and I did a call with a senator's office and aides about last year at this time. And we talked about those things. We have services and supports that we know work. There are fidelity scales. There are best practices that we know deliver on outcomes. To disinvest in those things that we know absolutely don't work. But to be able to do that, leadership needs to understand that their job is to do that. It is to deliver on an outcome.
Well said, sir.
Thank you, Richard.
Okay, there again, I'm loving this discussion and I'm loving moving out in and out of kind of what Richard and Doug and I thought we would go through. And I went to my desk just now because I want to read you something that I keep pretty close at hand. And I use it when we speak about the history of disability. And this is in I have the date, I have who said it. I'm not going to share any of that. I have the link where it was shared. And this was January 13th of 2011. And it's about defending sheltered workshops, low expectations, and of course, the underwriting piece is being able to see people as other. And this is what this person said, who is in a leadership role in this organization. Persons with mental retardation, using mental retardation, are not normal, and they never will be. Quit trying to make them something they are not. So one thing that I know, and those of you who train people, whether you are self-advocates, advocates because you're a humanist, or your job is to help change the system so that individuals with disabilities are not pushed to the fringe, or who are not disvalued or devalued or not seen as other. I am totally convinced that wedding practice, policy, and funding, and then tightly binding that to holding systems accountable for best practice and evidence-based practices outcomes is the only way to consistently, across all these systems, sustain change. And even there, we are in such marshy ground. It's not going to happen from the goodness of someone's heart. It's not going to happen from a CEO who put everything into having a person-centered organization, an organization that's supported using the best of what we know, like any industry or any profession, whether it's medicine or human services or business and marketing, to achieve the best outcome and contribute to our world, to make it better. So Doug, having said that, knowing that you have, I don't know, I really don't know if anybody has pulled together the information like you have in the book, and you combine the beauty of story with policy so that it makes it real. So knowing that you have pulled together information that we've never had that I know of, and I think that's why Cornell, just when you got down the dumps, kept wanting you to go on, wouldn't let you give up. So using the information you've pulled together, how can we continue to get involved to support such change in the legislative processes from that angle?
Thank you, Nancy. Well, I mean, just to build on what you've said, over the course of around 1998 to 2018, there were over, 4,000 violations of wage and hour every year. So those entities that fought so hard, those trade groups and lobbyists who fought so hard during the creation of the Workforce Innovation Opportunity Act, who actually kept it legal with lobbying money. I mean, let's be clear. It remains legal nationally, federally, because lobbyists spent money to convince legislators to do that. But the congressional record is so deep and wide that while it is immensely painful to read and to review, many of those organizations, some of the largest CRPs in the country, argued around that time, 2013, 2014, that all we needed was more oversight. But that if you figure that in that 20 years, there were almost 80,000 violations, and some of these are terrible, not just gift cards, but things that you just would never, ever tolerate for anybody you love. The challenge then is to inform what is before us. And if HR 2373 gets informed by those trade groups and lobbyists, who, by the way, now have permeated federal government, they're doing lots of things side by side inside of USDOL. Those folks, those entities should have no voice in creating this new policy. If we create it and it lasts another century, even in the absence of subminimum wages, what does it do for folks who are most dependent on those services? The fact that we've turned it into an industrial complex that really sees minds and bodies as billable units is something that we're going to have to address. And I think right now our best opportunity is to inform as much as we can. There are about 40 co-sponsors. We've talked about this with many of the communities of practice that we work with in the country, but to be informing those folks so that when the paid lobbyist says, hey, now we're going to need more funding for rehabilitation if there's no subminimum wages, that there is a real informed answer to that, because that's who has their ear. And unfortunately, even the organizations nationally that are connected to Employment First and disability rights as civil rights don't do enough to impact that. And I'm afraid, back to your question, Nancy, if we don't do those things, then we're just going to have a phase out and everybody will feel fine. So to me, this opportunity, back to Richard's point as well, it's fleeting. We don't know how big the window is to be able to influence this. So one thing we can do as citizens, not in our professional roles, but as citizens, inform those who represent us that that bill should be robust and should focus on the after effects of getting rid of something that we all know should have been phased out and done away with 30 years ago. Most people who aren't in our field will say, I thought that was outlawed decades ago. Well, we're right at 2:51. Richard, I see you blinking back on. But I want to I want to give other folks some opportunities either just to chime in or give Pete feedback or ask questions just in this last bit of time that we have. So I will check chat. Joseph, you've put in the discussion guide. Thank you, Stacy. Thank you, Cynthia. And the website. Any questions, comments, feel free to put it in chat or unmute now if you'd like to say something.
Hi, Doug. This is Lisa from Florida.
Hey, Lisa.
Hi there. I wanted to say, I got your book and I'm not through it because it's very emotional. So I have to read it in sections. And it's also, it's two things. It's a story. It's about people and it's so relatable, but then there's so much information that is going to need to be referenced again and again. And it's easy to reference that. So thank you so much. And still, and in meetings and councils and other boards, I am really kind of barraged by a few, or maybe one person saying like, oh, abolishing this is wrong. Everybody can't work. This is the right thing to do. And so I'm starting to form how I will be really good at talking about this. And I need a short answer. Do you have a short answer when you are confronted in an hour and a half long meeting where you're trying to get it on the next agenda and somebody hits you with that? Because it kind of stops the conversation and it's a lot of rhetoric, and I need to develop for myself some shorter, I don't know, taglines to carry it forward to the next time we can talk about it.
Lisa, that's such a great question. And by the way, Lisa, you probably don't know this, but I've gotten to read some of your wonderful Discovery staging records, and the writing and all of that is just beautiful. And you get to know job seekers so well. You're the epitome of just best practice. So thank you. I wish I could answer that, Lisa. Stacy Ramirez has put in, speak out, find your federal legislator. I think that's good. One that I do think, Lisa, makes people step back, and it's one that's kind of stuck in my head. And I have the book open here, so I'm just going to quickly read it. And it's about a CRP in the East Coast that was really focused on lumber and subminimum wages. But here we go. In 1 year alone, the organization paid one staff manager $570,000, all approved by the board of directors. As far back as 2001, the same organization had nearly 75 violations related to the Fair Labor Standards Act. Based on wage and hour is the subdivision at USDOL that has been charged in the past decades of oversight, and have admitted Donald Ellisberg, who's a great attorney who's still alive, living in Florida, by the way, Lisa, worked at wage and hour. I haven't been able to contact Donald in a year or so, but let's chat and see if we can. He said this is unfixable. When he was at wage and hour back in the middle 90s, it's unfixable, it's corrupt, it's broken. But to build on that, there were 77,855 subminimum wage violations across the country from 1997 to 2016. That is unfixable. No amount of oversight in our type of capitalistic culture will ever keep people from abusing that. It's impossible. And that's almost 4,000 violations a year. We can do better. It's poor public policy. Let's get together and make it better. It's not an either or like Americans love. We love it. Yes or no, blue or red, right? It is complex, and it takes everybody spending some time. Dr. Rackensberger has put something in chat. If you didn't join us for Tracy's Real Income webinar, it's archived, and it's beautiful. And Tracy can speak with authority there. Thank you, Tracy. But we might have time. Thank you, Lisa. Would love to talk to you a little more about if we can track down Donald Ellisberg. He's a hero, by the way, a guy who blew the whistle as an attorney as he worked there. He was the person who was supposed to do the oversight and said, in 1994, it is completely broken. We can't fix it. We can do a lot better. We only have a few minutes. Maybe take another question. Not from Richard or Nancy, but from someone else.
How insulting.
Anybody else?
Hey Doug, it's Kate. I have one.
Hey, Kate.
Hi, it's a thread from a comment you made at the very beginning about the idea that the new legislation, I'm assuming you're thinking HR 2373, ought to support people with disabilities, right? It ought to capitalize them beyond just sort of capitalizing the current system, aka the disability industrial complex. So I'm wondering, additionally to kind of safeguarding against dollars just going into DAHAB, right? Do you have other ideas around how we might make sure those dollars funnel directly to individuals with disabilities?
What a great way to finish up, Kate. Yeah, as you know, to this much better than I can, but we already have a mechanism in individual training accounts.
I thought about those. I wondered if that's what you meant.
Yeah, that folks can have access to. I mean, I think it's probably not going to happen to say to people, look, you owe back wages to folks. I mean, the Henry's Turkey Service was the largest EEOC settlement ever in $240 million, and the men each got about $40,000 in the end. So, being litigious that way, people protect those assets, and I think it's unrealistic probably for us to think that that would be the case. But individual training accounts in HR 2373, robust, so that VR doesn't have it, the state DD agency doesn't have it, someone's payee doesn't have it, someone has access to funds, and pairing that with really good skill sets to help someone parlay that into customization, I think is so important.
Thank you.
Doug, I know we're wrapping up, and I don't mean to jump in, but I just think this is so powerful, and we are talking about capitalism. We are talking about exploiting those who can be exploited because they don't have power, the money, or influence. The brilliant quote on your website by the brilliant thinker about looking at who benefits. And I want you to read it. I mean, I want you to state it if you would.
Well, I don't have it in front of me, but I know we've talked about it quite a bit. So we'll use that as a little tickler for people to go to abolish14c.com. But to paraphrase, it is, any problem in America, you don't solve that by looking at who suffers from it, by who benefits from it. And I think that's why this has been alive and well for so long. I just want to end here. As always, we will stay on. Our Virginia folks, we've asked you to stay on if you would like. But this, I mean this from my heart. Every one of you on here is somebody that I've connected with, either virtually or face-to-face, either through IHDD or Griffin Hammas or the work that we do in other states. And this book would have been impossible without all of your love and kindness and support. So it's really our book. I'm not great at promotion. It's not something I really relish, but I want to thank each of you for being on today and for spending time with us. I know that we can make this better together. And to do that, the lived experience must be elevated in every possible way, not in some token way, but in every possible way, so that there's a voice in HR 2373 for the people who have spent decades relegated to places they don't want to go. When they show that they don't want to be there, they get something else added to their behavior plan. The system needs completely overhauled and changed so that it works for everybody.
And Doug, I found the quote, if I could quickly, it's just
Thank you.
beautiful.
Thank you.
It's Dr. Amos Wilson. And for those of you from Mississippi, he grew up in Hattiesburg, where I grew up at one point.
I think it's only you
And
from
just
Mississippi, but.
Oh. Okay. Just listen to this and see how it fits with so much of what is happening in our world. If you want to understand any problem in America, you need to focus on who profits from that problem, not who suffers from the problem. Dr. Amos Wilson, beautiful human being.
Thank you, Nancy. For those of you who are still with us here, Joseph has put in the survey that helps us. I don't need to explain why. Please, if you have a minute or two to do that. Dr. Rackensberger will begin leading a curated group of webinars around this issue in Georgia, in building the coalition, the funding from GCDD. So please, please stay tuned for that. I think Joseph has just put that in chat. Thank you, Nancy and Richard, so much for agreeing. It's been an honor to do this with you. Thank you very much.
Doug, thank you
Thank-
for your work and contributions to the field and giving folks a voice.
Absolutely.
Thank you,
Yeah.
Richard.